Medical Surgical Nursing, questions 101 to 120. 101. A patient admitted to the hospital in hypertensive crisis is ordered to receive hydralazine, aprezoline, 20 mg for stat for blood pressure greater than 190/100 mmHg. The best response of the nurse to this order is to A. Give the dose immediately and once. B. Give medication if patient's blood pressure is 190/100 mmHg. C. Call the physician because the order is not clear. D. Administer the dose and repeat as necessary. The answer is A. Give the dose immediately and once. 102. Which of the following is the most appropriate first action for the nurse to take for a preschooler who has fallen and has a hematoma formed on the temporal bone? A. Encourage a nap. B. Give pain medication. C. Apply ice and monitor vital signs. D. Allow the child to continue activities. The answer is C. Apply ice and monitor vital signs. 103. The minimal amount of urine that a post-operative patient weighing 60 kilograms should pass is A. 120 milliliters per hour. B. 90 milliliters per hour. C. 60 milliliters per hour. D. 30 milliliters per hour. The answer is D. 30 milliliters per hour. 104. You are the nurse providing post-operative care for a 9-year-old boy who is 6 hours post-tonsillectomy. He is sleeping, but on routine observation you notice that his pulse has increased, he seems to be restless and trying to swallow frequently. Your immediate action would be: apply an ice collar to reduce discomfort. Allow child to keep sleeping and record observations. Wake him and offer some ice chips to suck. Check inside his mouth for any signs of bleeding and notify the physician. The answer is D. Check inside his mouth for any signs of bleeding and notify the physician. 105. When inserting a rectal suppository for a patient, the nurse should insert the suppository while the patient performs the Valsalva maneuver. Place the patient in a supine position. Position the suppository beyond the muscle sphincter of the rectum. Insert the suppository half an inch into the rectum. The answer is C. Position the suppository beyond the muscle sphincter of the rectum. 106. A patient with pneumonia is coughing up purulent, thick sputum. Which one of the following nursing measures is most likely helpful to loosen the secretions? A. Postural drainage. B. Breathing humidified air. C. Percussion over the affected lung. D. Coughing and deep breathing exercises. The answer is B. Breathing humidified air. 107. A patient is admitted to a hospital with acute renal failure. The patient wakes up complaining of abdominal pain. On assessment, the nurse observes edema to the patient's ankles and distended neck veins. The patient is dyspneic with a blood pressure of 200/96 mmHg. The proper nursing diagnosis for this patient is A. Deficient fluid volume related to disease process. B. Excess fluid volume related to decreased glomerular filtration rate. C. Knowledge deficit related to proper medication regimen. D. Acute pain related to renal edema. The answer is B. Excess fluid volume related to decreased glomerular filtration rate. 108. A patient arrives at the emergency department with slurred speech and a right facial droop. The patient's relative states the patient is not himself. Upon assessment, the nurse finds paresthesia to the right side of the body, receptive aphasia, hemianopia and altered cognitive abilities. The nurse should suspect A. A narcotic overdose. B. Parkinson's disease. C. Alcohol withdrawal. D. A cerebrovascular accident, CVA. The answer is D. A cerebrovascular accident, CVA. 109. The nurse is preparing teaching plans for several patients. The nurse should recognize which of the following patients is at greatest risk for fluid and electrolyte imbalance. A 2-year-old patient who is receiving gastrostomy feedings. A 20-year-old patient with a sigmoid colostomy. A 40-year-old patient who is 3 days postoperative with an ileostomy. A 60-year-old patient who is 8 hours post-renal arteriography. The answer is C, a 40-year-old patient who is 3 days postoperative with an ileostomy. 110. A 3-month-old infant is admitted with a diagnosis of ventricular septal defect. The physical assessment for this infant would reveal A. High-pitched cry. B. Harsh heart murmur. C. Bradycardia. D. Hypertension. The answer is B. Harsh heart murmur. 111. A young patient is extremely irritable due to meningitis. It would be most important for the nurse to A. Use low-level lighting in the room. B. Ventilate the room. C. Eliminate strong odors. D. Allow frequent visitors. The answer is A. Use low-level lighting in the room. 112. A male patient with a right pleural effusion noted on a chest X-ray is being prepared for thoracentesis. The patient experiences severe dizziness when sitting upright. To provide a safe environment, the nurse assists the patient to which position for the procedure? A. Prone with head turned toward the side supported by a pillow. B. Sims position with the head of the bed flat. C. Right side lying with the head of the bed elevated 45 degrees. D. Left side lying with the head of the bed elevated 45 degrees. The answer is D. Left side lying with the head of the bed elevated 45 degrees. 113. A newborn is diagnosed with ventricular septal defect. The baby is discharged with a prescription for digoxin syrup 20 micrograms bid. The bottle of digoxin is labeled as 0.05 milligrams per milliliter. The nurse should teach the mother to administer on each dose. A. 0.1 milliliters. B. 0.2 milliliters. C. 0.4 milliliters. D. 0.8 milliliters. The answer is C. 0.4 milliliters. 114. As a part of the treatment given to a child with leukemia, the child is placed on reverse barrier isolation to A. Protect the child from injury. B. Protect the child from infectious agents. C. Provide the child with a quiet environment. D. Keep the child away from other children. The answer is B. Protect the child from infectious agents. 115. The nurse should be aware that tetracycline is contraindicated in children less than 12 years of age because minimal doses are needed to control infection. B. Immunosuppression is a common side effect. C. Staining of the teeth is an adverse effect. D. They are prone to develop renal failure. The answer is C. Staining of the teeth is an adverse effect. 116. When caring for a patient with acute pancreatitis, the patient is most likely to complain of pain which is severe and located in the left lower quadrant and radiating to the groin. Burning and located in the epigastric area and radiating to the groin. Severe and located in the epigastric area and radiating to the back. Burning and located in the left lower quadrant and radiating to the back. The answer is C. Severe and located in the epigastric area and radiating to the back. 117. The best time for the nurse to teach an anxious patient about the patient-controlled analgesic, PCA, pump would be during which of the following stages of patient care? A. Postoperative. B. Preoperative. C. Intraoperative. D. Post-anesthesia. The answer is B. Preoperative. 118. Elevated levels of amylase and lipase in the blood are common in A. Diabetes mellitus. B. Esophagitis. C. Pancreatitis. D. Hepatitis. The answer is C. Pancreatitis. 119. In preparing the patient for electroencephalogram, EEG, the nurse should A. Withhold breakfast. B. Give sleeping pills the night before. C. Shave the hair. D. Restrict intake of coffee. The answer is D. Restrict intake of coffee. 120. An 11-year-old girl with a history of asthma arrives at the primary health clinic with signs/symptoms of shortness of breath, audible wheezing, nasal flaring and mild lip cyanosis. Your immediate nursing action is to A. Assess respiratory distress and peak expiratory flow rate. B. Take a blood sample to assess CO levels. C. Instruct the parents to take the child immediately to hospital. D. Sit the child comfortably and offer 2 puffs of Ventolin Stat. The answer is A. Assess respiratory distress and peak expiratory flow rate.